Welcome back from the break. I'm Uday Pratap Singh. You're joining us on News X as the new variant of COVID, Omicron, is spreading globally. The Omicron has, remember, been reported so far in 89 nations. Meanwhile, the UK has recorded the biggest jump of Omicron variant cases. Fresh 12,133 cases have been recorded in the last 24 hours in the UK. The WHO, meanwhile, is stating that the number of cases is, of course, doubling in 1.5 to 3 days' time in areas with community transmission. Amidst the Omicron threat, a growing number of nations are reducing the wait time for booster doses in a bid to ward off a new surge of infections from the Omicron variant. In the next 30 minutes, we will be understanding the Omicron situation globally, and we'll also discuss the significance of booster doses. Joining us at this point is Padma Shri Dr. Sanjeev Bagai, Chairman and MD Nephron. Joining us also is Padma Shri Dr. Mohsin Wali, cardiologist and physician. We also have Dr. PSV Rao, consultant surgeon, Columbia Asia Hospital, Hebal, Bengaluru, joining us live. Dr. MC Mishra, former director, AIIMS, also joins the broadcast. Dr. Mishra, let me begin with you first. Now, we've, of course, seen a very ominous warning from Dr. V.K. Paul, but I want to start out by, of course, asking your take on what he said and also on the latest Omicron spread, but also in particular, sir, do you believe now it is a time to consider booster doses for frontline workers actively and possibly also fast track those pending second doses that are still left?
Vinit, what Dr. Paul said was the worst case scenario. Translating what is happening in UK, the population versus these infected individuals coming every day or doubling in 3 days or 5 days or 1.5 days. So on that basis, he compared India's population and the numbers which we could get, 14 lakhs, that's what he said, which is possible. It is not impossible, but what we have seen, these projections many a times have not proved right actually. If you look at last year's projections in March, April, when the pandemic had just begun, most of those predictions, mathematical calculations went wrong actually. They were not on time, they were not on dot. So this is, I think this will serve as a cautionary measure for most of us when we have the feeling that COVID has gone or it's going away. So it is not going away, that's what he wants. And that always is subject to, if we do not take precautions, if we do not get vaccinated, if we do not do that. So I think what he said is a warning for each citizen of the country, and everyone has to cooperate in this so that we can come out of this also. If that happens, suppose surge does begin somewhere in mid-January or February as is predicted by Dr. Manindra Agarwal, Professor Manindra Agarwal of IIT Kanpur, and his predictions, I must say, have been closer than anybody else's projections so far for during this pandemic. And booster, of course, as I was going through one of the interviews of a virologist, that they have basically analyzed a report recently published on Omicron and the vaccine, vis-a-vis vaccines, that the Covishield, our own vaccine, and also Covaxin will protect against. So as we have been discussing time and again on your channel also, that instead of saying the booster, we say that this vaccine is a 3-dose vaccine to give relatively longer protection. But having said that, what I would say for India, if we look at the vaccination trajectory of most people have received vaccinations between July and now. So their protection will still last longer than expected. And people are thinking that most of these jabs have been given 1 year ago. Then I agree, yes, most people will need booster, like frontline workers, as you said, healthcare workers, and also those who received this year in January and February and March, those who received their jabs, both the jabs during those months, there is a case for a booster dose if the protection is going to be that strong that it will protect against infection 80% and against illness, severe illness and admission into the hospital to almost 60-70%. So I think that is where the challenge lies for the government. And those who are in the decision-making positions, that what do? Do they first complete the first round of 2 jabs, or they simultaneously begin booster for at least high-risk groups?
Okay, well, let me in fact also then go across to Dr. Wali at this point. Dr. Wali, now the
Yes.
WHO, of course, warning of a spread, also saying that in areas where there is community transmission, a doubling is happening in a period of 1.5 to 3 days. Now, thankfully, we haven't reached that stage yet. But what do we need to do now to ensure that that stage is not reached tomorrow, Dr. Wali?
Yes, in USA, the doubling is taking second day, doubling is taking 1.5 day in UK and so on. And as per the prediction of our respected Dr. Paul, if we calculate according to today's data of UK, the number would come 20 lakhs. So all these numbers are for taking precaution, not for taking a serious note of, it should not go in our brains like that. The emphasis, as Dr. Mishra said, to get the vaccination. This is one point. And time and again, Sanjeev Bagai Sahab has said that third dose, booster dose should be part of primary vaccination. This is balancing both the things. We should complete 2 doses at once, immediate. And this is most important. And people should observe the COVID appropriate behavior. Malls are full in Delhi-like cities. And people are going. Yesterday it was Sunday and people were overcrowding in malls. So to the extent that the parking were labeled as full, so nobody was allowed. So all these things are getting mixed up, and we are mixing up Omicron around the world.
Yes.
To the situation of Omicron plus Delta in India. We should segregate both the issues. Omicron quantity is still very small and it's not producing damage so far to the lungs. It is staying up to the respiratory tract, so it is confined. Luckily, we don't have deaths with that. And Delta, the older enemy, is still surviving. And people are now talking, and the scenario abroad is totally different than what is in India. India, we have to vaccinate. We have to vaccinate. Repeatedly, I'm saying this because this is the only thing in our hand. And there was a discussion yesterday, who would pay for the third dose and who would pay for the vaccination in children and all that we discussed yesterday. So yes, people like Adar Poonawala should come forward, who is donating significant amount to UK, and he should donate same thing to the India also, provide free vaccines. He and as per our finance secretary Somanathan Saab, he has also told, while the previous funds were sanctioned 35,000 crores, that if need be we would sanction. So finances should not come in matter. Second dose should go smoothly, and then we should work out for the eligible people the third dose. This is my take on it. And second thing, I would say that people are taking it very lightly. They should not take it very lightly, especially when the season is for Christmas, New Year, and schools are being opened. And there was a contrast yesterday, which I was unable to understand. Chandigarh says close the schools, and places like Delhi and Maharashtra say open the schools. These are the things happening. I don't know. At the end of the year, when we can afford to close the school, winter vacations, Christmas, New Year, so we can open it a little late. Shooting of the schools, people should be with express jibes immediate whose second dose is not, and apply this on this, that we should not compare the most to it, and we would somehow.
Okay. Dr. Wali, I think we have some problem there with your connection. Let me try and rope in Dr. Bagai at this point as well. Dr. Bagai, the international situation, of course, getting worse, with each passing day. Do you believe that alarm bells are ringing abroad, particularly in countries like the UK, which are breaking record after record on a daily basis? Also countries, other countries in Europe imposing immediate lockdowns, like Netherlands, because of the upcoming holiday season. Okay, I'm being told we've lost Dr. Bagai as well. Let me see if I have our other guests as at this point. Dr. PSV Rao. Dr.
Yes.
PSV Rao. Yes. Dr. PSV Rao, do you believe that it is a very alarming situation in certain countries across the world? Looking at, of course, the situation in Europe, also the United States, are you concerned? Do you believe alarm bells should be ringing right now? They should have, in fact, rung earlier. Why is the WHO waking up late as always?
See, in the Western countries, there is now there has been a lot of resistance against vaccine, far more than in India. Secondly, there has been far more protests there, and people going out in huge crowds and saying, we don't want lockdown, we don't want restrictions, we want to be freedom and all that kind of thing. Why is the difference between the two Western countries and India? I think the communication in India has been far better, and the attitudes of our people, they are used to a lot of adjustments, the tolerance levels are high. And there hasn't been that kind of protests and resistance and agitation to taking these. Yes, agreed. Large number of our people are not using the mask. They are taking life easy. It is not resistance, it's just that they are being very casual. So, listening to seeing what is happening abroad doesn't mean that we panic. At the same time, we can't be very casual thinking that this is not going to affect us in any way. The virus is very much around, all the variants are around, especially the Delta Plus and Delta, and now the Omicron is also spreading. So, what is our best defense against any of the variants? It is the mask. And secondly, avoiding crowds. We see that suddenly, in the name of due to the festival season, there has been a lot of crowding around. And all the weddings and functions which were held up, suddenly we are having a lot of them going. And now the elections are coming up. Already big gatherings are happening in the name of election. So, we need to be careful with this. We can't ignore all this. So, number one measure, everyone should be using mask, and good quality mask appropriately fixed on the face, not hanging under the chin. Second, avoid all these kind of crowds, and our leaders and our celebrities should, instead of encouraging crowds, they should actually be coming out on the media and requesting everyone to be careful. Third is a vaccine, which already Professor Mishra and Dr. Mohsin Wali have very clearly said. And I only want to add to that, saying that there are three groups of people whom we should now take as a priority and get vaccinated. One, the children. We have still not started inoculating the children, vaccinating the children, whereas it has been going on in US, UK, and other countries. We should start it immediately. And like Professor Mohsin Wali said, instead of, there is a lot of confusion in different parts of India. Different rules are, different instructions are being given if to have schools opening or not opening. So let us get the vaccination going, like he said, and delay the opening of schools till these vaccinations are done. Second group is, like Professor Mishra said, the people who have had the vaccination more than 6 months back. That is, all the high priority people were vaccinated first, like the health workers who are exposed to a lot of these viruses. Then the people who have got high morbidity, various morbid conditions, and who are more liable to get into trouble. So these vaccinations is also to be done. So if we, I think it is about high time, not just the Prime Minister, every important leader, every important celebrity should be drawn in to get the message across. And I think we got our message in India, we got the message across much better than what happened in the West. In the West, they kept saying, no, there won't be any lockdown. And then everyone was protesting, roaming around. And when they got the infection, second lockdown, third lockdown, third wave, fourth wave. And this is why the resistance is just going up by the day. We shouldn't get into that vicious cycle. So I think we should immediately, on a war footing, do all these measures. get people to start using the mask properly. Second is to avoid crowds. Third is to get all these people vaccinated straight away. And I think those who have already received the 2 doses, but got the second dose more than 6 months back, we should start giving the booster dose rather than waiting. And instead of getting into this argument, are these vaccines working against Omicron or not? All I would say is any vaccine is better than having no vaccine. So please take the vaccine, and it is going to take some time for these companies to make the alterations required so that the vaccine is effective against the newer mutants, just like we do for influenza virus. But it's going to take time. Instead of waiting for all that, please take the vaccine. At least it will protect you from landing up in the ICU and in the hospital, because that's when we have deaths and all these problems. And like Professor Wali said, one big difference is that this particular Omicron hasn't shown a tendency to cause immune hyperreaction, which is what lands up with clots and problems with breathing, problems with clots and inflammation in the rest of the body. So luckily for us, that is not happening, but there's no point risking and landing up with these infections.
Okay.
Yes.
Let me quickly, in fact, go across to Dr. Bagai as well at this point. Dr. Bagai, we're of course looking in this particular segment at the explosion of Omicron happening internationally. What lessons can be drawn from what's happening abroad in how to handle or rather what not to do as well, in terms of course, containing the Omicron spread? What are the lessons we can learn from abroad, and also what are some of the things that we can take from what they've done wrong so that we don't replicate the same in India?
Good evening. Sorry for joining in late, but I think the Delta variant which created havoc worldwide, perhaps you could say it's partly because of anti-science and ignorance. But if we allow this to precipitate now, we have more than 60,000 gene sequence cases of Omicron worldwide as per this afternoon, and it's spreading to more than 38 countries. If we allow this to precipitate in India into a big surge, it will be nothing short of arrogance. This is unacceptable to have large crowds, political rallies, which are still happening as we speak today. There are mass gatherings in Punjab in various religious sites. None of the so-called political leaders are even remotely wearing a mask. There is not 6 feet social distancing. There is not even 6 inches or 6 centimeters social distancing. So really the message for everyone who's watching this is that it's really up to all our society's hands and our political leaders' hands. We know that this is airborne. It can be hugely avoided by wearing a good, well-fitted N95 mask, both the people wearing a mask, keep a distance of more than 10 to 15 feet, don't attend social gatherings or political rallies or any other congregations, marriages, etc. at this point of time. I will not stress anything beyond the fact that double vaccinations will save you from serious illness, ICU admissions and death. We are waiting for the government approval for the 3rd vaccine, which I believe will come shortly. I would have hoped that it should have already come by now. And we need to protect our children because they're completely unvaccinated. So we need to do the simple things simply without complicating things. I don't think we've got rid of COVID at all. And I dare say this may not be the last variant, so to say. What the worldwide data has shown is that this is now having a doubling time of 1.5 to 1.8 days. That is disastrous. That means every 1.5 days, the total number of patients which we are going to see are going to be doubling. I will not call it still mild, although it is 70 times more in the upper bronchus, because more transmissible means more spreadable disease over a period of time is going to give more number of cases as a caseload. Apart from the fact that the long COVID still stands. So we need to be of utmost care. Winter temperatures dipping down, especially in northern parts of India, is going to enhance the transmission. Pollution enhances the transmission. A vast segment of population are only one vaccine done in India still. And I think we need to really step on the vaccination campaign very, very aggressively. But really, the people who are public figures like politicians should set an example. setting an example of 10,000 people gathering in a corridor at a religious site in Punjab is no message at all. Over to you.
Okay, let me in fact also quickly go back across then at this point to Dr. Wali on, of course, also the immunization strategy, which also should be looked at right now before things get too out of control. Now, we do know already the COVID-19 task force has been meeting. We do know that the DDMA met today under the chairmanship, of course, of the Delhi Chief Minister as well. Similarly, many other states' task forces have also been meeting to look at what sort of measures are needed currently. But Dr. Wali, as far as the immunization strategy is concerned, what kind of relook is needed right now?
Look, yes, we have to be very fast. She's smart completing the immunizations. We have lagged behind. And Omicron is a dress rehearsal for the next pandemic. There was a short article with this heading I just read, that Omicron is a dress rehearsal for the next pandemic. It's a very dangerous science coming up, and we are taking it too lightly. You see, we should not take it too lightly, because there has been talks for a super mutant virus, Omicron combining in a single individual at the peak of the wave, and then combining with Delta, giving it to a more disastrous virus, which can penetrate more than what it is penetrating now. So keeping all that in mind, we have to seriously look at the immunization of children, very seriously. I think that somewhere finances are coming on this way. I don't know, I may be totally wrong, but if this is the case, then people like Adar Poonawalla should generously come out and don't donate outside India. Just today I was reading Adar Poonawalla family donate 50 million pounds for Oxford Vaccine Center. In our country, we are making money out of the vaccine. In other countries, we are generously donating. If you want to donate it to the African countries. So this disbalance of finances, I had been talking finances, politics, and medical science. This is a weird combination. This coronavirus is a weird combination of these things. And finances should never come in the way. We have been generously vaccinating our people, and we have enough vaccines. Covaxin is sufficient quantity. It being exported to so many countries. So the profit which we are making by selling this vaccine to the richer countries should be utilized to supply the vaccine, and no way it should be stopped. And as I was telling that when 35,000 crore was 1,000 crore, yes, when was granted, our Honorable Foreign Secretary assured that if the funds will fall short, we will replenish the funds. So there is no dearth of funds. Go ahead with vaccination. Catch the people. Where is that Dastak door-to-door Dastak program going on? I don't know. Nobody had come to my house. Nobody has come to my neighborhood. You see, this program was very important, that you have data and you can go to the houses of people and motivate them for vaccination, bring them to the vaccination center site. And those who are debilitated people cannot go out and they are stranding in their houses on the beds, go and vaccinate. So we have enough staff, and I'm proud of my country that we have enough people to vaccinate India, and it should never lag behind. And we have shown it on the birthday of the Prime Minister, how huge quantity we can vaccinate. Then why delay? Delay will be killing, disastrous. Every day, as Dr. Bagai said, these cases are multiplying. We should not take it lightly. We should take it seriously. Fact is that somehow nature is helping India always. And we are not being suffering like second wave we suffered so far, which we would have done by now, as the UK and USA is showing the results. They are banning travel. They are doing strict measures despite their biggest annual festival of Christmas. There are restrictions, and we are opening schools. So this kind of things is it has to be very academic decision. Every decision should be very academic. I'm not pointing my finger to anyone. You see, we have both types of decision: close the school, open the school. So we can't do two things together. And I'm very hopeful that DDMS today's meeting would bring with this meeting some concrete results out this evening, and we should be very happy by night. Something solid and concrete should come out, and because they are studying this situation, and Dr. Guleria's warning yesterday or day before yesterday, which came to be very, very careful. You see, all this combined, I'm very hopeful that something good will come out of DDMA's meeting today, and we would learn from the past experiences. We should not forget that, and people should have self-restraint, Self-restraint is the only golden thing we can do ourselves, and we should be careful. As Dr. Bagai has been saying, we all are saying that don't go out unnecessarily, don't crowd the malls, don't go out in the closed spaces, don't eat together, and don't go out in the crowds in the weddings and all. And please do celebrations with a minimum of number of people or avoid them.
Welcome back from the break. I'm Uday Pratap Singh. You're joining us on News X. The Omicron variant continues to spread across India, and our best bet to fight the virus is still vaccinations. India has completed administering of 138 crore vaccines, and our second dose coverage for adults is now past 55%. But besides vaccinating children, the focus should continue to be on ramping up vaccinations and also the third dose. So is it time to relook at our procurement strategy? Covishield maker Adar Poonawalla recently said that they might have to cut down production. Currently, 75% of the procurement of vaccines is done by the centre and supplied to the states. Let me quickly go across to our guests who are live with us at this point. Just quickly draw up our list, of course, of guests who continue to be with us. We have Padma Shri Dr. Sanjeev Bagai, Chairman and MD Nephron, joining us live. Padma Shri Dr. Mohsin Wali, cardiologist and physician, is live with us. We also have Dr. PSV Rao, consultant surgeon, Columbia Asia Hospital, Hebbal, Bengaluru, with us live, and Dr. MC Mishra, former director AIIMS, is also on the broadcast with us. Dr. Mishra, now, if we are going to be relooking at the booster doses strategy and also the, the fast tracking of those who still have not got their double doses, is there a need to also look at the procurement strategy to also further incentivize others to enter production? Let's explore this aspect also a bit. Dr. Mishra.
Absolutely. If we look at, first, let's look at if boosters are helping. So there is a very recent study from Imperial College London where they have done work on AstraZeneca, which is Covishield in India. So this AstraZeneca gives protection against severe disease caused by Omicron. This is specific to Omicron, is only 20%, the two doses. Whilst the protection against death is about 30%, the two doses. A booster protection against severe disease rises to 80% and against death 88%. So if something to go by this data, then I think there is a serious case for considering a third dose. Similarly, two doses of Covishield, they prevent against Omicron only 3%. But after booster, the protection goes up to 39% against Omicron, and against Delta, it goes up to 80%, 81%. So I think this is a very, very strong case for now, considering that we have doses already there. So at least give the option to people. And as you rightly said, the procurement also has to be commensurate with the need. And as we know, many countries, even UK and USA, the vaccines expired and they had to be destroyed. They did not export those vaccines. So that also has to be looked at by the international community, that instead of that vaccine goes waste, it could be used in Africa and other countries where the vaccine supply has been very short. Because pandemic remaining anywhere will not protect the whole world, because whole world can only be protected if the whole world is protected. So that is something which every government has to understand. And the data, what in India, what we discussed some time ago on your show, that 45% of those between 45 and 59 and also above 60 years of age did not receive their second dose. So we have also a challenge lie ahead for us. So we must simultaneously start vaccinating whichever vaccine is available and give incentive to those vaccine manufacturers who are manufacturing doses, and they should not cut down on production, as Dr. Mohsin Wali was rightly mentioning. When we don't mind Adar Poonawalla, because whatever they will earn from AstraZeneca vaccine, it is out of research from Oxford University. So donating to them, we don't mind that, but simultaneously they should match to support India in the vaccination drive, and the cost should be the last thing which should come on the plate when considering vaccination, the whole vaccination program.
Absolutely. Let me, in fact, also take that across to Dr. Bagai. Dr. Bagai, do you also believe that we need to relook at our vaccine strategy? We also do need to relook at the procurement strategy at this point, or do you believe, as it is currently with the centre, procuring most of the vaccines and supplying it to states with very little percentage left to private hospitals, is the way that we should move forward for the next 6 months at least? Dr. Bagai? Okay, I'm being told we've lost Dr. Bagai there. Dr. Wali, let me direct that question to you, sir.
Yes.
Is a relook needed? Is a relook needed?
Yes, very strong relook needed, and I am expecting a very good relook from the Disaster Management Authority from Delhi and also all over India. We are not serious. Only media is serious this time. Let me say frankly that. The media is showing everything. The media people have studied Omicron than the scientists themselves. And they are going through each and every study which is coming from around the world. Media is doing a good job. But we, the people, are not listening to you. That is my problem. Why people are not listening? This is a greatly depressing scenario for me. I am very frank with you. I am very frank on your channel and on every channel almost, that this time media is teaching us and to the public what is to be done. And the public is not following that. They are listening. They are not following. And this is what we say, an axe to the grind. We are doing that phenomenon. And the results will not come today. They will come after 3 months. If something bad happens to the virus, mutation, another mutation, or something is spreading to the community who are not vaccinated. So we have to be coming again. We have to be very, very punctual, regular, and strict for vaccination. Buy, borrow, or steal, get vaccine. 1. Number 2, mask, COVID appropriate behavior, practice it. Don't know it. Everybody knows by now COVID appropriate behavior, nobody is practicing. This is a tragedy, biggest tragedy I am seeing and you are seeing and everybody is seeing. And they're casual. People are taking this virus and even Delta virus now because they think Delta has gone. We are lucky, India is lucky somehow that we are not getting cases of Delta virus because of the large exposure in the past. Most of the people have got exposed and got automatically immunized. This is one natural reason we are not getting so many cases. And despite the best efforts, 3 doses and 4th dose in Israel, they are also getting case. So at least two vaccinations is a must. My earnest request, humble request with all those who are listening to propagate this message that please complete vaccination. And if that message is gone through this program, we have done the job.
Okay. Let me in fact get in Dr. Rao as well at this point. Dr. Rao, now you can of course also comment. Okay, why don't you go ahead and first tell us about your take on the relook at vaccination strategy, and then I have another follow-up question for you. Dr. Rao.
Yes, earlier you asked about the procurement.
Yeah,
See,
exactly.
We went through this whole confusion in the second wave when states protested that they should be allowed to have the freedom of buying and doing things. And you saw the chaos that followed that, with some of the companies saying we can't be dealing with each state separately. And many of the states have then complaining that the prices quoted to them was high. So then we had to go back to the central procurement that is working. What is working very well, there is no need to disturb it. So again, the central government has to take a decision. We are waiting for it. We are all hopeful that they will decide on the 3rd dose. We have all spoken enough about it. Once that is decided, who is to be given? Obviously, the same priority list as during the first and second waves, and during the second wave. So let the people who had it in January, February, and then in March, April, let them get it. 3rd, who is going to pay for it? See, US has had to go to the extent of paying people to take the vaccine. At least we don't have that problem. Let the government pay for it. It is after all the taxpayers' money. It is this is worth doing it so that we have all the poor people and all those who can't afford the vaccine getting it. And during the second wave, we allowed private hospitals and private set clinics and nursing homes to also give it, good, go ahead with it. And we extended it to various people at their place. If you, those of us who are on Twitter have been seeing any number of videos of health workers crossing, climbing mountains, crossing rivers, going to all kinds of difficulty, even through floods, to inoculate people, even in their farms, in their villages. So that has to be continued. What can we do to enhance this whole process? Central government has to take a quick decision. They should offer a advance payment and order to the companies so that we don't want Adur Poonawalla or tomorrow Ella Krishna to say that because we don't have any orders, we are reducing production. We don't want that kind of situation. So give them an advance order, pay them quickly, and continue with this. We have already said this with children who have not yet been inoculated, though there are a lot of countries where the children are being vaccinated, to the people who have been vaccinated earlier, and to also the high risk people. Now, we need to get this message across that this is a serious situation. If you are going to have celebrities and others having major weddings and functions, and you have politicians holding large rallies, you and religious leaders having their own big sessions, we are giving a wrong message to the people. So all these people have to be told, kindly come on the media, please request people to avoid crowding, and don't set a bad example. They set a bad example, everyone is going to say, okay, there's nothing to worry, we go ahead. So the crowding has to be reduced. There shouldn't be any crowding. There should be a mask, and the procurement should be, they should place the advance order now itself, and they should give approval for third dose. Meanwhile, those who have not had the first dose, second dose, especially the children, see, 40% of the, India is a young country. I think nearly 40% of the population is all not even been given the first, offered the first dose. Forget, so they have not even been offered. We have had second dose only to somewhere around 55-56% of the people who have been eligible till now. And first dose has a whole lot of the rest of them have had only the first dose. Even now, even today, patients who came to my clinic, when I asked them, have you had your vaccination? At least 3 of them said, no, sir, we have not even had the first dose. And when I asked them why, they were giving all kinds of lame excuses. I told them very clearly, there is no excuse not to take the vaccine. And if only if we can get most of the population vaccinated, will we prevent another wave. And if we prevent further infections, we will prevent mutation. The virus can mutate only if there are patients getting infected. So severe infection or mild infection, anyone getting infected, the virus can mutate in that person. So this message has to be got across. And I think the media now has been doing a great job of calling experts onto the and getting them to talk. I think it's high time all these important people, the VIPs, who are holding meetings, whatever be the cause, they have to be, the media should go and catch them and tell them, please, you set a good example and you appeal to the public that please
let me ask you then, what kind of restrictions are needed from now itself, because various task forces are meeting, various committees are also being convened once again. What sort of restrictions need to be looked at immediately, Dr. Rao?
Yes, one, all these VIPs should stop holding big sessions. People should stop calling a whole lot of relatives and friends to their weddings and other things. The old restrictions which we said, there were during the second wave, the same thing again. It doesn't matter which variant is around. The restrictions are the same. Use N95 mask rather than an flimsy mask. Wear it properly. Keep your distance. Social distancing. Avoid crowds. This is common, irrespective of which mutant comes around. Any respiratory infection, for that matter, can be prevented. And I have been repeatedly saying the mask will help people also to avoid allergies, avoid dust, and to avoid any kind of respiratory infection. So let them get into the habit of it. I'm a surgeon, and Professor Mishra here is also a surgeon. We are used to wearing the mask throughout our life. There is nothing unusual for us. It's good if people also get used to using the mask. What is wrong with it? And there was shortage of masks to begin with. Now there is enough masks, there is enough PPE suits, everything is enough, and vaccines obviously are enough. And so we should go ahead with this. And there is nothing different just because of Omicron. The precautions we have to take is no different. And if everyone does this, we won't have a third wave, and then we won't have to have lockdowns and more chaos. People should realize it's not only a question of getting into hospital and running around trying to get an oxygen cylinder and a hospital bed like we had in second wave. It also avoids lockdown. It is for our own good that all of us follow social distancing, wearing of I would suggest actually N95 mask. The surgical mask is not meant for preventing inhalation or exhalation of a virus. It is basically meant for us surgeons not to infect an open wound of our patient. So that is a 3-layer mask. It's not going to be good enough. And N95 mask is not expensive. It's much cheaper to buy a N95 mask and wear it. Maybe the government can start providing free, just like during the family planning, they were providing free barriers. They can also provide free masks and ensure everyone wears a mask.
Okay, let me take that to Dr. Mishra. Dr. Mishra, what sort of restrictions do you believe are needed on an immediate basis right now, without, of course, unnecessarily affecting the economy of the country, but also ensuring that lives are not lost?
I'll agree each word what Dr. PSV Rao has mentioned. Along with that, I would also encourage, and it's true, Vineet, if you look at even in media, people have not got vaccinations. Do you know that? A lot of media people call me, sir, should we get vaccine? I said, what for you are waiting for 1 year not to get the vaccine? So it is very, very important that a lot of people who are talking about this problem have also not received the vaccination. So that is one thing which can be encouraged, and also cover the vulnerable population upfront and encourage all of them to receive vaccination. And Omicron actually has done that everywhere, even in UK, even in other countries where there was vaccine hesitancy. Omicron scare has brought people to the vaccination centers in these countries, also in India also. Now, because at one point of time we were complaining the vaccine is not available. Now it is available, people are not coming forward. So I think that is something which needs to be encouraged. And as Dr. Rao was mentioning, that in USA people were paid to receive the vaccination. In India, we didn't have to do that, and I don't think it will be ever done for that purpose. But since this is so infectious and doubling time is 1.5 days to 2 days to 3 days, and this is like the upper respiratory tract infection, but in whom it will become lower respiratory tract and will end up in with severe disease and in ICU, that can't be predicted. So the only way it can be prevented by vaccination, and it's a good thing that these vaccines, whatever existing vaccines, are also effective partially against this variant. I think that's a good news. So why people have this hesitancy before people come with tweaking the vaccine to work against the new variant? And as Dr. Rao mentioned, that it is to overemphasize the point that more will be the infection, more will be the mutations, and more will be the problems. So I think next one, we are slated to have 25 lakhs marriages in India during this season. So avoid attending these marriages, please give your gift or whatever you want to contribute to somebody's marriage by digital means, by not going and attending those marriages. I avoided one at 11th of December, and one can do this. People don't mind. People would invite. Naturally, it is their function, so they would invite, but they will not force you to come if you give them good reason. And this is a good reason for their safety, for our safety. So we can't overemphasize this point. Even Election Commission must listen to all this and do not declare elections in February or March. They should wait for April. Heavens will not fall down if some governments can extend their term by 1 month or 2 months, or there could be a president's rule before elections. That last year also we discussed this point. Election Commission must listen to this, because what Professor Manin Agrawal from IIT Kanpur and I consider his predictions have come very close to reality in second wave. They also came true, for other predictions also came true, and he is predicting a peak in February. So I think we are through trying times again through January and February, and to avoid that are very simple, what Dr. Wali emphasized, the COVID appropriate behavior, what we have been discussing for close to 2 years now, and about the importance of masks can prevent 95 to 96% times infection transmission in the community. And even if you get with mask infection, it will be a less severe infection than we anticipate. So all these things will serve and go a long way in protecting our chaos again about the healthcare infrastructure, which has been built to some extent, but it is again unlimited. Large number of people from large number will get infections, and hospitalization will be a large number. So the beds may fall short again. The hospital beds, the ICU beds, already there is the problem of quarantine those who are arriving from overseas. I heard somebody called me this morning and asked, there is someone has been found positive, COVID positive at the airport, and there is no facility right now for quarantine in most hospitals. So I think that is something which also has to be looked at in the Delhi government meeting, on DDMA meeting, as Dr. Wali was mentioning, that they should expand this quarantine. And in MEX, as you know, they isolated all the patients in 8 patients. So one patient had a Omicron, will pass on to other 7 also. So I think that also needs to be looked at, because the Omicron spreads much faster than Delta also, and Delta Plus or whatever Alpha variants we had in the past. So I think we all are saying the same thing in a different way.
Okay. Let me allow a last word. I've run out of time. Let me allow a quick last word to Dr. Wali before we close.
Yeah, what has been told by Dr. Rao and our Dr. Mishra, I fully agree with that. I was reading and listening a paper and a talk from University of Southern California. Dr. Carlos was mentioning that travel restrictions can be very good, in addition to what we have discussed. I don't want to repeat. So I'll close this by saying that we should be very wise in making travel plans. Apart from that, we should use masks and COVID appropriate behavior, and listen to you and to the experts what they are saying, and follow that religiously. Save lives, save India, save everybody from COVID. And otherwise, bad situations will come, and we will invite ourselves, and nobody will be held responsible. So everybody has got responsibility, be it a political meeting, a social meeting, or a school, or somewhere in the crowd, in the malls, everywhere. We should have restraint, and that would be the golden time for next 2 to 3 weeks. And then we can enjoy later.
All right.
Just one point.
Let's leave it at that. We've run completely out of time. I'm going to have to leave it at that. My thanks to all of our guests for joining.